I love the job. It's, you know, you spend all your time following around a doctor, which is the best part, and you get to see everything that the doctor sees, sometimes for the first time, or, you know, rare cases, and basically document everything that needs to be documented. Because I wanted to be in a hospital, and the exposure that you get here is just, you know, you can't compare it to anything else. So I think, you know, the other option was working, you know, in a doctor's office, you know, as a receptionist, but that's, you know, you can't even compare that to this, so that's awesome. Training is intense. You start out in classroom style, you know, you're given a packet and you have to review a lot of terminology, a lot of abbreviations, and then you go through about, I guess, 8 hours it was with the head scribe, and she explains everything from how the computer system works to the proper way to write a history, everything that's important, and you have to study outside of what the training class, and you know, it takes a little bit of endurance, but it helps when you become familiar with everything on your own. It makes the job easier once you start, and then you shadow the head scribe for about 6 shifts with different doctors, so you get familiar how different doctors work, and eventually she, you know, whoever the head scribe is would coax you into doing it yourself. So you follow her or him, and then you do it on your own. So it actually works really well because you're not just shoved into it blind. You're kind of introduced slowly, so it makes it easier. At the beginning, it was the most challenging, obviously, getting comfortable with the doctor names and you know, all the ordering the tests and knowing how to write a history properly, and you know, learning from your mistakes and realizing how important it is to get feedback. But once you're comfortable, after like a few months, it's not difficult. It's more, I think, exciting, and once you get in the hang of it. So,
cool.
I guess, you know, I can't say anything really shocked me, but I just really appreciate being able to see the bedside manner and patient-doctor interaction across, you know, how different doctors work, how different it is. And it's not, you know, like on ER or Grey's Anatomy and the way a hospital works, how quickly you learn that it's not what you think it is. And I think the most interesting really is just learn how doctors act with patients and how nurses act with patients and all the dynamics. I think that's been the coolest, like, has taught me the most. If you want to be a doctor or a PA, there's really no better job you can have. And, you know, for me personally, my first interview for med school was, I think, 3 or 4 weeks after I started this job. And I used, you know, 2 or 3 stories that, you know, from observing what was happening here in my interview, and, you know, I got in. And it was, you know, changed everything, because before I had this experience, you have what you have or whatever, but being here with the doctors and nurses in the hospital, experiencing what happens in the emergency room, gives you a lot. And I think it just completed my story of why I want to be a doctor and why it just made my interview so much better. So